So if you're dealing with neck or back pain and maybe you've been diagnosed with a bulging disc or herniated disc, just wanted to talk briefly about, kind of how we treat that, how we address that. I think a lot of times people get sort of focused on that diagnosis of a bulging disc or herniated disc, and they start to kind of chase that as what needs to be solved or treated. And that often happens in the medical system as well. So you go to your doctor, you get a MRI or an X-ray, lo and behold, they find a bulging disc. And then oftentimes they'll refer you out to have something like an injection or other treatments that are designed specifically to try to address the bulging disc. For me, the bulging disc is not the problem. The bulging disc is a symptom of a problem. So if you think about a disc as this water balloon being a disc, the discs sit between the vertebrae of your spine. Now, if we're in a good neutral spinal posture, there's an even pressure on all of the discs. So if I take this balloon and I kind of press down evenly on the balloon between my hands, that disc kind of is dispersed evenly around my hand, as you can see. But if I deviate from that postural position, in other words, I create more stress on one side of the disc because of that position, then what will happen is the disc will bulge out to one side. So again, when you look at it in this way, you can see that the problem isn't the bulging disc. Because you can imagine that if we took some kind of magic cream or injection and we injected that into the disc, that might indeed shrink that disc back into place. But if I haven't changed the stress or the force on that disc, what will happen over time is the disc will begin to bulge again. So the easy or the obvious solution here is, instead of trying to treat the disc, treat where the pressure is. By creating a more even pressure back onto that disc again, that disc will return back to its more central location. So oftentimes what we see posturally that can cause bulging discs is we'll see at the neck, we'll see someone who tends to have a posture something like this, we call it forward head position. And you can see that increases the curve of the neck, which once again will create that added pressure to one side of the disc. So if we get someone to move from this posture to a posture more like this, you can see I'm changing the pressure on that disc, which will help that disc move back into place. Other areas that you can see this too would be at the mid-back or the thoracic spine. Similar type of a posture. If we allow our spine to kind of fall into this position, it's the same thing. We're getting that adverse stress on one side of the disc, which may cause it to bulge. And then at the lumbar spine, it could be a few different positions. One position can be not enough of a curve, or the other position could be too much of a curve. So a lot of times what we have to do is address that by first looking at, is there mobility available in the spine in order to move it back into its neutral position. And then once we've resolved that or established that there's no longer a mobility problem getting in the way of that, then we can train that individual how to maintain that posture when they're moving or exercising.